Hello, I'm Dr. Stephen Mulholand, plastic surgeon from Toronto, Canada, and I'm going to introduce a very unique and versatile aesthetic platform, perhaps the most unique and versatile platform in existence in the aesthetic space, essentially an entire medical spa in a box. It's called the Inmode. You have all the innovative, non-invasive RF applicators you could hope to want. You've got skin rejuvenation, an SR photo rejuvenation applicator, and a very high speed, painless pre, intra, post cooling, light shear meets painless hair removal, maintaining pulse duration and fluence to get efficacy, all in one box. So we're going to walk through the skin rejuvenation IPL handpiece. I'll do a little demonstration, and then we'll show the LHR, the laser hair removal diode, high speed, ultra cool handpiece with thermal imaging. So let's take a look at the device first. We can zoom out a bit. This is the Inmode. A very nice mobile unit that you can move between the rooms. It locks, got all the standard features you want to see for safety, FDA cleared. Can we focus in on the screen here? This is the screen. At this point, it uses a series of menu and up and down driven buttons. Right now, all we have is one applicator plugged in, which is our SR, or skin rejuvenation, IPL photo rejuvenation. It's the 515 nanometer cutoff filter. So you're going to use this on your skin types 1, 2, and 3. It also comes with a 580 cutoff filter, which you'll use on your 4s and 5s. Again, quick reference guide, standard photo rejuvenation settings that I've been using for a decade and a half will be built into the system. Very simple to use. So you simply hit the check button, and up comes the application that you want to see. It goes through a self-test, loading all the various parameters. Also discharges the capacitor to get things ready for you to use. And now you have a number of things you want to set. You want to set the joules per centimeter squared of the fluence, and I have standard photo rejuvenation settings that will be available to you all. And you can go up and down. Standard settings when you're first starting out, 14 to 16 joules per centimeter squared. There's a very strong IPL flat beam configuration. So when you're first starting out in very light skin type 2, 14 to 16 joules per centimeter squared, and we talk about the principles of each treatment. You have less pigment, so you're going to use a higher fluence. Now you've got the pulse type. There's a short and long pulse duration. And in general, it's 2 joules per millisecond in short, and 2 millijoules every 2 milliseconds. So it maintains the fluence in a flat top over a short or long pulse configuration. The more energy, the longer the pulse. So it automatically sets that for you. We're going to use short pulse today, so we'll go down to pulse, and we can go either long or short. Now we go down to an important part, the cooling. It's a dielectric cooling system. There's low, medium, and high. Generally, I use low cooling for everybody. Sometimes if you're at the end of a therapeutic treatment regime with a lighter skin patient and you want to get a little more oomph, you might use medium or high cooling. When you're first starting out, always strong cooling. And then we've got the automatic repeat. You can have this in the off mode, which means every time you press your finger or the foot pedal, you get a single pulse. In the automatic mode, you can keep your foot pedal depressed or the finger applicator depressed, the finger trigger, and you'll automatically pulse. Either one pulse every 2 seconds, 1 pulse per second. 1 pulse per second is tough to keep up with because this is a very big footprint, 8 by 30 millimeters. As we move down the menu, you can move between screens with this one. If you purchase a system that has hair removal, skin rejuvenation, and the multiple RF non-invasive applicators, you can shift between the screens of those that are plugged in with this utility. You can control the volume output with this one right here, and then you can come back to the beginning. So 16 joules per centimeter squared is what we're going to start with a short pulse duration, and we are going to use very cool, low cooling, which is 10 degrees Celsius. Let's zoom out a little bit now. So this is the screen for adjusting your parameters. Zoom out a bit more. This is our skin rejuvenation applicator. Very ergonomic, easy to hold. The design allows you to get into interstices like the nasal-facial junction, lower lid. You've got enough projection away from the actual handpiece you can get into those areas and not awkwardly. This is the zoom in closely. This is the treatment footprint. 8 by 30 millimeters, very large spot size. When I use 1 pulse per second, I can treat the entire face in about 4 minutes. I will often combine this with the fractura, fractional resurfacing in the same session, and the firm. And you'll see that in subsequent webinars where we look at combination therapy. You can see the yellow color. This is in the yellow spectrum with a 515 cutoff filter. So we're going to go ahead and do a live treatment on a patient. I'm going to put this back in the cradle, and when we come back, we'll do our live treatment. Let's look down at our console now as we move in to do our treatment. We've got all our parameters set, the fluence, the pulse profile, which is going to be short. We have strong cooling, which is 10 degrees Celsius, and we've got a repeat, 1 pulse per second. We now, when we're ready with our parameters, we hit the check button here. We go from standby to ready. We're ready to go. Zoom out just a bit. We take our handpiece. Now the handpiece has a hand trigger to control with your finger if you desire, or a foot pedal. Most technicians prefer the foot pedal when doing multiple repetitive treatments on large areas, but it gives you the freedom, the option to use either the foot pedal or the trigger. We're going to come up to our patient now. We have our young patient here who has very nice skin, a little bit of erythema. She's got a little bit of discoloration. Zoom in here, we can just show the cheek. So she's got some discoloration of the nose. She's got a little lentigine here, some mottled discoloration. Perfect intense pulse light photorejuvenation, photofacial IPL patient. First of all, we want to protect the eyes always from bright light. Remember, with the RF systems, optical protection not so important. But once you get into laser hair removal or IPL photorejuvenation, we always want to be safe. So go ahead and put on your goggles there. Nice, certified eye protection, ocular protection. Once it's comfortable with the patient, we turn. Now, generally with the photofacial SR, InMode, IPL rejuvenation, with the SR, you can do this with topical, and there's enough strong cooling, you don't need a chiller. Some patients who may be sensitive, you can add the chiller in a double-handed technique, traditional technique. We're going to take a little bit of ultrasound gel. Again, this is standard IPL protocol. And we'll do a hemi-face. We'll do it slowly initially, so I'll show you how it pulses, and then we'll go to automatic 1 pulse per second, and we'll do the entire side of the face, single pass, in 2 minutes, 2 to 3 minutes. Very quick system. You want to overlap about 20% to make sure you don't get any striping. Remember, when you're off the face, we're going to use about 2 joules per centimeter squared less off face than on face. And in thin areas, you may turn down the energy a bit. Okay, we've got the hemi-face gel on, and now we've hit ready, we're ready to go. I'll do a couple of test pulses out here, and generally you want to wait about 5 minutes after a couple of test pulses to make sure you have the end point, which is a little bit of edema and some erythema. I'm going to put my finger on the trigger, zoom out a bit. Finger on the trigger right here to let it emit the intense pulse light. 1, 2, 3, and a little pulse. I'm going to overlap about 20% pulse. How do I know? I can see the imprint on the gel. That's how I estimate my overlap. Now, she's got a little bit of pre-auricular hair, so there's a smell of photocoagulation of hair. You warn the patient about that. Not many women miss their sideburns, so don't worry about removing a little bit of hair in the pre-auricular area. And you'll do about 4 or 5 pulses like this, and we're going to wait a couple of minutes. And you're going to wait a couple of minutes just to make sure there's enough erythema and edema. Now, if they're a driver, in North America, the left side of the face is often more photoresponsive to SR applicators because there's more melanin exposure, more dyschromia on the driver's side. If they are in North America, the right side may use a little less energy than the left. If they happen to drive in Europe, the right side may actually be more photoresponsive. Again, all the standard indications, contraindications that I'll go through in the webinar, in the PowerPoint, on who to treat, who not to treat, what are the parameters. Right now, we're just going to look at the live treatment. So we've waited a few minutes. Zoom in here. You see a very mild erythema, a little bit of edema. If I waited about 4 or 5 more minutes, the edema would be stronger. When this is the first treatment, this is a good endpoint. You do not want to be too aggressive, especially if you're going to use fractura right after this and firm. So let's go ahead and do some treatments. I'll start out slow with my trigger finger on intermittent. We'll do a pulse, 1, 2, 3, pulse. And then overlap, 20%, pulse. Overlap 20% and pulse. About this time I'll ask the patient, is that acceptably comfortable?
Very much.
Okay, very comfortable. We've got very strong cooling, remember, at 10 degrees Celsius. Now I'm going to go to automatic. I keep my foot on the pedal, on the foot pedal, or my finger on the trigger. And because of the ergonomics of the system, the handpiece doesn't get in the way of treatment, which many other applicators, not so ergonomically well designed, you can't get in close enough to all the interstices of the face. One of the many reasons I like this Photo Rejuvenation SR handpiece. Okay, let's go to automatic now, and we'll see how quickly we can do the hemi-face. Keep your finger on the foot, and about every second you're pulsing. I'm sliding along, overlapping about 20%. Come back, same thing. Overlapping about 20%. Smooth the gel around. Again, overlap about 20%. Smoothen the gel. As I come towards the eye, I'll often go vertically as I get very close. We'll do one more vertical pass, and I'll turn horizontally. Very fast, nice cooling. Of course, if they're a little sensitive, you want to slow it down to a pulse every 2 seconds and allow the cooling to be more effective. As you come closer to the eye, I turn from vertical to horizontal. We can come to the lower lid margin, stretch the skin. And now I won't go automatic pulsing. I'll take a little bit of gel, move that up to under the eye. And now we won't do automatic pulsing. We'll do one pulse at a time. Get close to the eye, right near that ciliary lash line. Move slowly across the lower lid junction. Again, the eye shield is protecting the eyeball. Get right in close. You're allowed to get in close because you've got that room, that clearance. With the design of this applicator, the crystal is elevated away from the plastic of the handpiece, allowing you to get into difficult areas like that. Stretch the skin, slowly move into position, get right up near that eyepiece. I'm right near that eyepiece. Get right in near that eyepiece and get that discoloration near the eye. Now the side wall of the nose, again, simple to treat. Make sure there's some gel. Simply use your contralateral finger. Come in vertically against the nasal ala and move up the side wall of the nose. Along the side wall of the nose, angling each pulse, angling each pulse. Now, with the bridge of the nose, if there's not a big bump, you can simply zoom out a bit, you can take your handpiece, SR handpiece, turn it vertically and treat the entire bridge of the nose with a single pulse. Remember, this is 8 by 30 millimeters. You get a large treatment spot size, and you can treat the entire bridge of the nose, okay? Now, as you come up and you take a look at that face, you can see there's a nice erythema, little bit of edema. I'll often do a second pass. And so if I've gone vertically one way, I'll go horizontally the second pass. That took us all of about 1.5 to 2 minutes through the entire face. So a second pass, press your finger, and again overlapping about 20% each time. If after your first pass there's a lot of edema or you see some vesiculation, of course you stop. Do not do the second pass. During the webinar, I'll go into the settings, the approaches, the contraindications, indications. This is just showing the live treatment. Very quick, effective device. Very well designed IPL. Of course, you'd expect that. This is brought to you by the people that brought you all the IPL predecessors with Luminous and with Cineron and now with Inmode. Okay, second pass, very simple. Now what about the brow? Sometimes the brow is a little more sensitive. You may have to turn it down in fluence or turn it down in speed and cool. So now I'll go off automatic because the brow is a small area, and I simply come above the eyebrow hair. Be careful not to singe the eyebrow hair. I'll take my tongue depressor, protect the eyebrow hair from above take my device, put it on the skin, and then allow it to cool. Full contact, let it cool, and pulse. Let it cool and pulse. Give it about a second of cooling. At 10 degrees C, that'll cool down the epidermis. And cool and pulse. Cool and pulse. Move across the supraorbital area. Protect the eyebrow hair. And again, cool. 1, 2, and pulse. Cool and pulse. Now with the chiller, that brings even more pain control to the skin, okay? Now when treating the upper lip, I'll often use zoom out, show me the upper lip. I'll show the chiller come down from above and cool the upper lip skin. So if you have a Zimmer cooler, very effective. If you don't, simply come down onto the white roll, avoid cosmetic tattooing because you will lighten it, and you simply rest it on the upper lip. Let the chiller, 10 degrees C, do some work. Hold it there for a couple of seconds. And then 1, 2, 3, and pulse. Move along, cool, let it cool, 1, 2, 3, and pulse. And 1, 2, 3, and pulse. Same with the lower chin and the parasymphyseal region. You want to allow it to chill and pulse. 1, 2, 3, and pulse. Often around the teeth there is dental sensitivity because of apical caries or an amalgam that's loose or irritated. And sometimes you get dental pain represented by skin pain. That happens in the pterygopalatine ganglion. So this is a trick I learned long ago. If they complain of dental pain during IPL, simply take your tongue depressor, open your mouth, lift this up in the buccal space, and do your IPL over top of that applicator. This alerts the pterygopalatine ganglion that the actual discomfort is coming from the skin and not the referred dental pain. Lift that away from the teeth and treat. And this has worked for me since the ESC and the vasculite days as a way to minimize and eliminate completely dental pain during IPL or RF treatments. Simply create proprioception and the body knows where to send that discomfort. People don't mind a little skin discomfort. They really don't like dental discomfort. So we finished our treatment with the SR applicator from Inmode. If we take a look at the patient, there's certain characteristic signs you want to see at the end of the first treatment. We zoom in on her face. You can see there's areas of edema and erythema, but it's mild. You got to be careful with IPL. Of all the things that I use, fractional RF, firm, non-ablative RF, Botox fillers, IPL is the one thing you've got to be careful of because it can get you into blistering pretty quickly. Zoom in even closer here. You want to see that kind of erythema and edema at the end of the treatment. She's a very light-skinned patient, so the fact that we got this much erythema shows you how strong this can be. For darker skinned patients or photo damage, 2s, 3s, and 4s, you really light up the pigment. So again, erythema and edema is what the endpoint you want. The very first treatment, this is exactly your endpoint. Now each visit, once a week, once every 2 weeks, once every 3 weeks, you're likely going to go up in fluence about 1 to 2 joules per centimeter squared every visit because the pigment that this SR handpiece relies upon, the chromophore, is disappearing. To get the same thermal stimulus, you need more energy with less target. But again, we'll save that for the webinar when we go into parameters. Often nowadays we do combination therapy. So I'll often start the visit with the SR applicator as the great color corrector, like Photoshop of the skin. Then we bring in Fractora for tissue tightening, texture, and wrinkle reduction like nothing else. And then you might even finish with a non-ablative firm or send them to your med spa or your medical estheticians for firm treatments. You can combine this with injectables, fillers, and toxins. Really, in this device, you have an entire medical aesthetic spa, non-invasive practice in one platform. Let's watch for the webinar and we'll find out more about the SR handpiece from the Inmode platform.